Hello, good morning. I'm Nicola. I'm a medical student. How may I address you?
I'm Peter.
Okay, hi Peter. I'm going to examine your legs this morning, okay?
Sure.
Alright, so could you roll your shorts up for me as high up as it will go? Yeah, that's great. Thank you. Okay, we just relax, okay? So the first part will be inspection. So you inspect from the foot of the bed as well as from the side of the bed, looking at the large muscle groups to look for any asymmetry or any wasting, okay? Also look for obvious fasciculations. Look into the feet area to see if there's any guttering. Okay, if there are no obvious fasciculations, then you will need to flick in the large muscle groups in order to elicit possible fasciculation. So flick in the quadricep area and then in the calf area. Okay, so there are no fasciculations. The next thing will be to elicit for tone. Okay, so for this, Peter, is there any pain in your legs? Okay, so I'm just going to gently rock your legs back and forth, okay? So just relax for me. Okay, so you gently roll the leg to check for tone and do the same on the other side. Okay, next thing will be check for tone at the knee. Okay, so you put your hand underneath the leg like this. Okay, so Peter, I'm just going to lift up your leg. You just relax, okay? I'll do it for you. Okay, so you flick up the leg and then, okay, Peter, just relax. Just relax. That's it. Okay, so flick up the leg and then catch to make sure that the heel does not hit the patient's leg. Okay, so do the same thing for the other side. Good. Okay, that's fine. Great. So that will be tone at the knees. Next thing will be to check for ankle clonus. So Peter, I'm just going to bend your knee like this. Okay, so just relax. Okay, and I'm just going to move your foot. Okay, so relax for me. So forcefully dorsiflex the foot to look for any clonus. Good. Okay, just relax. Very good. Same thing on this side. Very good. Okay, so you can relax now. Great. So that would be the tone in the lower limbs. Next step will be to move on to reflexes. So get your tendon tapper. So we'll be doing the knee jerk as well as the ankle jerks in the lower limb. Okay, so for the knee jerk, you'll need to help support the patient's knee, okay? So Peter, I'm just going to check your reflexes now, so you just relax for me, okay? So support the patient's knee and you want to strike along the patellar tendon. Okay, so gently strike and look for contraction in the quadriceps. There you go. Okay, great. So put on this knee. Okay, I'm going to do the same on the other side, okay? So just relax for me again. Relax. So find the patellar tendon and strike to look for the knee jerk. Okay, that's great. Alright, so now I'm going to bend your knee now. Okay, so again, relax. Okay, so you're going to do the ankle jerk at the Achilles tendon. So for this, you need to dorsiflex gently. Okay, so Peter, just relax. Relax, okay? Yeah. So gently stretch the Achilles. Hold your tendon tapper and strike the Achilles tendon and look for contraction in the calves. Okay, so same thing for the other side. Okay, just relax for me. Okay, very good. Just relax. Good. Okay, alright. You can put your leg down now. Okay, the next reflex will be the plantar reflex. For this, you need a orange stick. Okay, so you need to explain to the patient because it can be quite uncomfortable. So Peter, I'm just going to draw on your foot with the blunt end of this stick, okay? So it's a little bit uncomfortable, so just bear with me for a while, okay? Alright, so you get, again, can you bend your knee? Okay, very good. So just draw on the base of the foot on the outer aspect and hit towards the big toe in this direction. Okay, so you do that. And look for any response in the big toe. Okay, very good. Okay, I'm just going to do the same on the other side. Okay, so same thing. To draw on the outer aspect of the foot until the base of the big toe. Good. Okay, thank you very much. Alright, so that's the end of the reflexes. Next one would be to check for power. Okay, so you would ask the patient to do several maneuvers to help you to assess for power. Okay, so Peter, can you put your leg up like this, straight up like this? Okay, I want you to keep it in the air and don't let me press it down, okay? So you're checking for hip flexion. Okay, good. Okay, the other leg now, just keep it in the air. Don't let me press it down. Good, okay. And then now I want you to keep your leg on the bed. Don't let me lift it up, okay? Great, and this is hip extension. Good. Okay, and the other side, just keep it down. Don't let me lift it up. Very good. Okay, and we check for knee flexion. Okay, so just bend your knee now. Okay, now keep it in. Okay, don't let me pull it out. Okay, keep it in. Very good. Okay, now straighten for me. This one bend. Okay, just keep it in. Don't let me pull it out. Very good. Okay, now I want you to push out against me and make your leg straight. Good. Okay. And just the other side now. Okay, just straighten for me. As hard as you can. Very good. Okay. So that's knee flexion and extension. Okay, now you move down to the ankles. Okay. So Peter, can you point your big toe towards your head? Good. Just on one side. Yeah. Okay. I want you to keep that up there for me. Don't let me push it down. Okay. Very good. And this side. Keep it up there. Don't let me push it down. Good. So that is ankle dorsiflexion. Now ankle plantar flexion. Can you step down on my hand? Step hard. Very good. This one, step hard. Very good. Okay. And then you'll check the toes. So Peter, can you put your big toe up like this? Good. Okay, don't let me press it down. Very good. And this one now, keep it up there. Don't let me press it down. Very good. And then for toe flexion, can you curl your toes over my fingers? Good. Okay, don't let me open it. Great. Okay, and this one the same. Curl over. Excellent. Okay, very good. All right, so that's the end of power. We'll move on now to checking sensation. So same thing with the cotton. Okay, so Peter, I'm just going to touch your forehead now with a cotton ball, okay? Okay, do you feel that? Okay, so that's normal, okay? So I'm going to touch your legs now, and again, if you could tell me whether if it's not the same as on each side or it's not the same as your forehead, please let me know, okay? And I'll also be asking you which side I'm touching, okay? So if you just keep your eyes closed.
Left.
Good. Now?
Right.
Good.
Left. Right. Left. Right. Left. Right. Right. Left. Left. Right. Right. Left.
Okay, very good. We'll do the same thing now with toothpick, okay? So if you open your eyes now, this is a toothpick, okay? So I'm just going to touch your forehead again. Do you feel that? Yeah, okay. So again, the same thing. If it's not the same as your forehead or not the same on either side, let me know. And I'll be asking you which side, okay? So you just close your eyes again.
Right. Left. Right. Left. Left. Right. Left. Right. Right. Left. Left. Right. Right. Left.
Okay, very good. Okay, so that's sensation. The next thing to test will be vibration sense. Okay, so Peter, you can open your eyes now. So this is a tuning fork. Okay, so what it does is it generates some vibration. So I'm going to put it onto your toe, and then when you don't feel the vibration anymore, you let me know. Is that okay? All right. Okay, so you use the 128 Hertz tuning fork. So strike and then place it on the metatarsophalangeal joint. Okay, and ask, do you feel the vibration? Okay, can you tell me when it's gone?
Gone.
Okay, so it should be about 8 seconds. Okay, so we try the same on the other side. Do you feel it?
It's gone.
Okay, very good. Okay, so that will be vibration sense. Next we will do position sense, again with the big toe. Okay, so Peter, can you just look at this now? I'm just going to show you, okay? So this is your big toe. This is up and this is down, okay? Okay, so if you just lie down now and close your eyes, I'd like you to tell me whether it's up or down, okay?
Up. Down. Down.
Good. Okay, same with the other side. So just remember to hold the sides of the toe and not up and down, because then the patient can sense pressure. Okay, so hold it away from the other toes as well. Okay, so Peter, again.
Up. Up. Down.
Okay, very good. So that will be position sense. We'll complete the neurological examination of the lower limbs by asking to do the cerebellar examination for coordination and gait. And then we'll move on to do the Romberg's test. Okay, so we'll now proceed to do the Romberg's test. Okay, so Peter, Could you put your feet together and just stand straight for me? Okay, very good. Okay. So at this point, you want to stand next to the patient so that in the event that he falls, you'll be there to catch him. Okay, so Peter, can you close your eyes for me? Okay, very good. You can open your eyes now.